we're excited to answer your questions. Now let's do some introductions. I am Dr. Linda Thompson, and I'm Executive Director of Drug-Free Manatee, and I'm going to be facilitating this conversation today. And I'm going to introduce my esteemed panelists. I'm going to go by how they appear on my screen, so it'll make it easier for me. We have retired Major Connie Shingledecker from the Manatee County Sheriff's Office. We have Susie Ardilla from Manatee Public Schools. We have Dennis Romano from Manatee County Sheriff's Department. We have Jane Tingley from Centerstone, our mental health provider. Sandra Stone from the University of Florida. We have Nathan Scott from Florida Department of Health, Child Welfare Policy Coordinator. And William Knight from Bradenton Police Department. And he has some colleagues there with him who might join in and share some experiences. And then Dr. Scott Young, who is with us, who is our epidemiologist on this particular project. I also want to mention that this webinar and all of the support you're going to hear us talk about that can be provided to you in your Handle with Care projects is supported by SAMHSA. And so we want to acknowledge their support of spreading Handle with Care across the state of Florida. All right, let's just dive right in because you know everybody's got a lot of great things to share. So Connie and Nathan, I'm going to start by posing a question to you if I can. Can you tell us a little bit about what Handle with Care is, where it got started, and then how did Manatee County get involved in this project?
Well, okay, Nathan, I'll start it off, and if you want to add in some things, but I'll talk for a couple minutes. Short and sweet, it's an email notification from law enforcement to a school administration's single point of contact that alerts them that a child has been exposed to a traumatic event. There are no details of the event provided, just the child's name, the school that they attend, the grade that they're in. We also have put in the date of birth because many children had the same name, and so we wanted to make sure it was clear who they were. It allows the school to then observe the child's behavior and respond appropriately to that behavior. So law enforcement responds to many calls where infants and children are witnesses or victims of crimes. Drug overdoses, traffic crashes, drug search warrants, neighborhood violence, domestic violence, injury or death of a family member, and certainly child abuse and neglect are just to name a few of the types of calls that would be traumatic to a child or an infant. Infants and children may be traumatized as a result, and so Handle with Care provides law enforcement an opportunity to complete a simple, easy to fill out notification and email it to a school administration single point of contact. And as far as Handle with Care goes, that is the end of the law enforcement responsibility for Handle with Care. The Manatee County itself started Handle with Care in April of 2017. We learned about Handle with Care during a drug endangered children training in 2016. Our community, like many others, was suffering from a severe opioid problem that led to heroin abuse and a significant drug overdose issue. During our DEC training, several school counselors stayed afterwards and complained that they were not getting information about children that were present during drug overdoses, drug search warrants, child protective investigation removals, and all of these things are extremely traumatizing to the children. The DEC presenters, as they listened to all of this discussion, said, hey, have you heard about West Virginia's Handle with Care? And that's when we said, no, let's learn about it. And so we reached out to West Virginia, and lo and behold, we received all kinds of information, and we decided to implement this with fidelity. So this model. So we received immediate support from the Manatee County School Administration. They were on board right away. They knew that having this information about a child exposed to trauma, where the learning switch is off, was going to be so helpful to addressing these child's needs appropriately. So when a child was acting out, they wouldn't punish the child, they would be able to respond appropriately. So we had them on board, and then we met. Our law enforcement leaders all meet on a monthly basis in Manatee County. So we used that opportunity to meet with all law enforcement heads of the agencies to get their buy-in, and they did buy in. We then worked as a team to complete a one-page form that we got drafted and approved that allows us to email this information to a school point of contact. So once that was approved, we continued with our monthly meetings to allow for the sharing of data and other pertinent issues. And we were off and running with Handle with Care, being supported by all law enforcement agencies within the Manatee County jurisdiction. So Nathan, did you want to add anything to that?
You covered it really well, Connie. The only things I would add is that one of the things we looked at was that for children specifically in child welfare, we're only required by federal law to notify the school of children that are removed. And so we really were concerned about those children that could potentially fall through the cracks, and Handle with Care seemed like a way that we might be able to capture those kids. In addition to that, we looked at this as both a primary prevention strategy to prevent long-term effects from traumatic events taking place with those children, and also a secondary prevention strategy where we were trying to prevent long-term effects from getting even worse. And we also really liked the idea of the collective impact model, where the various sectors came together with a common agenda to solve a common problem.
One thing I'd like to mention about the team, we have a law enforcement officer representing each law enforcement agency on our team. We have someone from the school administration that is on our team. We have mental health, we have child protection, we have a psychologist. We just have quite a variety of different folks, and a lot of members are from Drug Free Manatee. So the core came from the group of Drug Free Manatee, who actually brought drug endangered children training to our county. So that was the core group of us together, and we've expanded it since then, and we have, would you say, about 15 to 20 members that meet monthly to have a discussion about how our Handle with Care is going. And as we move through this, we'll talk about things that we've learned and how we've improved the discussions that we have at that monthly meeting.
Thank you, Connie and Nathan. That was a really good starting point and foundation for what we're going to talk about. As they mentioned, then it was West Virginia who first launched this model and has provided all of the resources that those of us across the country that are embracing Handle with Care can take advantage of. So we're very, very grateful for all the work that they've put into it and continue to put into it to support these programs. So from this point, what I thought would be a logical shift would be to maybe walk through with my panelists what a Handle with Care call looks like, feels like on a daily basis. So I'm going to shift right now, and I'm going to share with everybody what would be the Handle with Care flow chart, if you will. I hope everyone can see that. Please let me know if you can. So as we look at this flow chart, and again, it's one that is has fidelity to the model of Handle with Care. I'm going to ask our different stakeholders here to kind of expand for me what this feels like on a day-to-day basis. So if we start with the child, we have a child who is exposed to a potentially traumatic event. And again, as Connie mentioned, and I know as a family therapist, what's traumatic to a child is very difficult for us to define, because it's all about context, it's all about their own resiliency factors, it's all about all the risk factors. So we're not there to really define trauma for a child per se, but we're there as the adults in that moment to recognize that something out of the ordinary that impacts this child in some way is going on, and others need to be aware of it. So I'd like to kind of shoot this back to, if I can, my law enforcement people, and and maybe even Nathan should talk about the child welfare impact, but what does that look like for law enforcement as they try to identify children, interact with children? What would that be like?
Well, Linda, I'll chime in if you want. I'm sure Captain Knight can add to this, but from the beginning, when we began discussing trauma to children, we started to kind of put an identity on what kind of calls we thought that would be. And we ended up not doing that because we determined that it could be anything. If a law enforcement officer goes to the scene of an investigation and feels that a child witnessed some sort of trauma, send in the form. We'd rather them err on the side of caution and let us figure it out.
Good point. Good point. Do you have anything you would want to add to that, Captain Knight?
No, I think Captain Romano hit it exactly on the head. It's better to just fill out the form and go on the side of caution. The child could always use the help in lieu of missing out on that opportunity to get the child the assistance and the attention they would need.
Okay. So is there anything specific you train your officers on in terms of how to engage with the child in a situation like that, or how to get that needed information?
Well, of course, law enforcement goes through, lots of training, and there's no real single response to any type of call because there's so many different ones. But we make sure that all law enforcement knows that they have to interact with the children in all these investigations, because not only is it a valuable source of information for our investigations, but we have to also identify that these children are victims or witnesses of a horrific event. So, it's a matter of understanding that your job is more than just responding and making sure people at the scene are safe. You need to make sure that there's long-term care involved also.
Excellent point.
This is Connie. One thing I want to mention when we were providing the training to the squads is we said to them, if your child had witnessed something like this, how would you want that situation to be handled? Just understanding, again, putting themselves in that position. If this was my child, I would want someone to be dealing with my child appropriately at school the next day. Because just think about the behavior. If the child has been up till 2 o'clock in the morning, depending on their age, and witnessing some traumatic event, how would they be behaving the next day? And how would you want the school to react to that behavior? Well, if the school doesn't know that they've been exposed to trauma, and the child is, if they're in daycare, they're biting another child, they're going to get punished, maybe even kicked out of daycare. Or if they're hitting someone at school, or they're having a meltdown at school, the behavior, they need to be aware that that behavior is a result of trauma. And that's the benefit. So I don't want to take any thunder away from Susie, but when we talk to the officers, we really want to get that message across to them, to see it from that perspective.
Awesome. Great point. Okay, so then we're at this point where the handle with care notice is sent. And so we may have a lot of law enforcement people out there in this webinar that kind of want to know what's involved for them. What do they have to do? So anybody want to enlighten us on the day-to-day? How does this notice get to where it needs to go?
Well, I know we discussed this early on also, and most of the people on the panel are painfully aware that law enforcement does not like new stuff in their lives, like new forms and new procedures, and sometimes it's tough to get them to buy in. So we made it as simple as possible. It's a one-page form, and here at the Manatee County Sheriff's Office, we actually added a link on an email that all they have to do is type in "handle with care" and the address, which is of course Susie's, comes up, and they can email the form. So it's fairly simple. You put the child's name on it, their date of birth, and their school, and Susie eventually gets the email and takes care of it from there.
Awesome. So now in Manatee, we've chosen an email system, and we know that in different areas, we've heard other handle with care programs in different states are using different systems as well. So this is something that could definitely be talked about with different teams about different ways to share the information, but email is currently the way that Manatee does it. I know that Handle with Care West Virginia is currently in beta testing for a mobile phone app as well. So we're looking at other ways that information can be shared, but this seems to be a pretty streamlined, easy way to do things, right? So, so then, Captain Romano, then the Handle with Care notice, that's sent out in a certain time frame, correct?
Yeah, I'm hoping that they send them while they're still conducting the investigation or completing their report,
Okay.
so that it doesn't get forgotten and lost in the shuffle.
Okay, but there's a goal, right, to try to get it, hopefully get it to the school by the next morning if possible.
Exactly.
Right. Okay. Great.
One more thing about the form is our form is fillable online, so it's not a paper form that has to be Xeroxed or copied or scanned. So
Okay.
it's fillable online and therefore very easy to email. And we've included the email address on the form itself, so that makes it even easier.
Right. Absolutely. Thank you. Okay, so now that Handle with Care email makes it to the designated school personnel, so you're up, Susie. What happens when you get a Handle with Care email?
Good afternoon, everyone. Thanks, Connie. You did such a great job explaining how everything works. So once law enforcement fills out the form, they email it to me, and then I look up the student and I send it to all support staff, including principals, assistant principals, teachers, registrars, and counselors. I also alert the social workers at the school. I do not include any details of the incident. I just put their name, their date of birth, and their school.
Okay. And Susie, I think also, isn't there a little bit of work on your part to kind of quickly investigate maybe a history for this child to see if this truly is maybe a child with ongoing concerns, or whether this might be one of these children that we were talking about who has been under the radar?
Right. So at the time of the incident, I look at their behavior record, their performance, their attendance, and then I track the student 30 days after. So we want to ensure that the appropriate interventions are taking place at school, or referring them to community agencies that can further assist the student and the family.
Right. Okay. So then as we go
Susie,
ahead.
I'd like to add one more thing to that. The school, just to mention, the school resource officer and the school nurse were two individuals that we felt were extremely important, as well as the teacher. But those three were so critical to getting this information, because if this child started acting out, we didn't want the SRO to not be aware. So the SRO has the opportunity to actually know a little bit more, can research the type of call and know more details. But the information is not provided, the details are not provided to anyone else. Kids were going into the nurse and saying, my tummy hurts. And it wasn't so much their tummy hurting as it was the trauma that they were experiencing was manifesting itself as a tummy hurt. So it was important for the school nurse to know that this child had been exposed to trauma, and that they could just let this child have a quiet place to be able to decompress and get themselves together. So it was very important that the school nurse didn't just blow it off and say, hey, you need to go back to class, there's nothing wrong with you. And of course the teacher, it was critical because they're interacting with that child. Even when we have multiple teachers, we want them to be aware when that child comes in and they might have a book report they're supposed to do, how traumatizing that can be if they've been up till 2 or 3 o'clock in the morning, why their homework isn't done, and how critical that can be as well.
I would just add for the nurse piece, if we think about what is the first thing a nurse does when a child comes to, maybe one of the first things when a child comes to the clinic is call home. If there's a Handle with Care notice, that may not be the thing that they want to do immediately. They may want to sit back and let that child, like Connie said, have a place to stay and avoid calling home for the time being, and just allow that child to have a place to stay.
Yeah, really good point, Nathan. So as we're following the flow chart again, if additional support other than the handle with care notice that Susie sends out to her staff there at the school, if then we've got the, already in place, the school counselor, the social worker, the nurse, all these people we've talked about. And if at that point additional support is identified, then we can jump into mental health services that are available through the model that the public school already utilizes. So Jane, what can you talk to us about how mental health can step in here with Handle with Care?
Thank you. So I'm going to talk about this process on a twofold situation. So Connie mentioned some somatic symptoms, tummy hurting, maybe a headache, when a child goes down to a nurse's office. The other part of that is sometimes there's some behavioral responses. A child can become verbally or physically aggressive. And at that point, the school can contact us and we can send our mobile crisis team out to the school to help de-escalate that situation. In addition to that, we have our school-based therapists. Each of our 51 public schools has a school-based therapist assigned to it, as do all of our charter schools. Our charter schools has our prevention and intervention teams that are assigned to those schools. So if the school identifies that this child needs some further assistance or further support, they will provide a packet of school release so that we can provide ongoing mental health therapy. Obviously, that packet has to go home to the parent or the guardian to have signed. If we have any difficulty, we actually have a liaison here at Centerstone that's able to provide that service so that we can physically go to the home and get that paperwork signed so that we can provide that additional support for mental health therapy at the child's school. It is at no cost to the parent or to that family, which is obviously an added bonus, especially in this this financial crisis and COVID type situation that we're all in. So it's really a great opportunity for all of our students to be able to have that option to participate in.
Awesome, thank you.
Yeah, Linda and Jane, just one more thing. When we first were learning about Handle with Care from West Virginia, and we got to this piece, the mental health piece, they told us that after 3 or 4 years of collecting data on these cases, that only about 10% of the children needed anything more intervention, mental health therapy wise. Only about 10% needed that more in depth. The rest of the kids just really needed to be handled with care. They just really needed somebody that dealt with them and monitored those behaviors and dealt with them appropriately and didn't really need any in-depth therapy. So that's probably a good thing for you to be aware of if you're starting to segue into starting a Handle with Care. Oh my gosh, how is this going to work? If we don't have all of this available to us. It's not that common that we need more in-depth therapy.
Thank you, Connie. Appreciate that. Okay, as we finish off the flow chart on how this works, again, all of the systems are in place and we continue to monitor and support the child as needed and continue with typical classroom activities. Dr. Stone, is there anything you would want to add about any nuances to working with early childhood learning or daycare?
Well, I think just that as we got into this program, starting to notice that not only were there school-age children that were involved in these incidents, but very young children as well. And the Early Learning Coalition in Manatee County was very interested in having the training extended to include daycare centers, and they wanted to be part of the Handle with Care program. So we were able to get a small grant from our local community foundation to put together training workshops for daycare providers so that they could be aware of the impact of trauma on very young children and respond appropriately, which is a little bit different because they're often nonverbal or if they are verbal, they're really not able to clearly articulate what's happening for them. So they do act out and to interpret those behaviors. And what we know is that trauma has a very significant impact on the development of young children, particularly their brain development, and that 90% of brain development happens before age 5. So if something is going on with those very young children and their development is impacted in a negative way, it can have long-term consequences for them. So we were very excited about extending this program to the daycare centers and trying to catch those very young children so that we can respond appropriately and get them back on track very quickly.
I just want to, that was such a wonderful way of explaining all of how we segued into the daycare circumstances. And I will just share with you one case when we talked to the daycare staff. This is a case from probably 25, 30 years ago. But we had a toddler, a 2-year-old, on the playground of a daycare bite another toddler, a female. It was a male biting a female 35 times, all over the face, back, arms, head. It was just incredible. And you can imagine that that child got kicked out of daycare. Many of them that are aggressive like that do get kicked out of daycare. But today, if we were looking at that case, we would be asking not just why was daycare staff not on top of this, and why did it, why was this child able to bite this child 35 times? But we would also be asking, why is this child biting someone 35 times? What's going on in that home setting that is prompting this child to behave and act out this way? So we know that that is a behavior that may be driven by witnessing domestic violence or the child being abused themselves. So there are so many, if you haven't had an opportunity to read the study on ACEs, Adverse Childhood Experiences, or to watch the film Resilience, we highly recommend that you do that. It gives you a better understanding of the impact of trauma on us as adults, but it starts in childhood. So it's Adverse Childhood Experiences. You can go to the CDC's .gov website, and they have all kinds of good information on ACEs, Adverse Childhood Experiences. So this, when we started learning about Handle with Care, we had to learn about adverse childhood experiences, and we actually show that film when we do the training for the daycare staff, and how critical it is to recognize that young children exposed to trauma carry that trauma with them. The body retains that, and it can have an impact on their health as they go into adulthood. So thank you for letting me share that.
Absolutely. That's a very important message. All right, we're going to take a breath here after following through the flow chart. We're going to do another quick little poll to find out what everybody's thinking at this point about their community and about whether or not, now that you've heard about some things, Handle with Care is something you're interested in. So if everyone could just give a shot at this quick poll, we'd like to know what you think at this point. And then what we're going to do once we finish this poll is I'm going to launch into and try to do very quickly so we can get to questions and answers. How do you get Handle with Care started? What is it you need to do, and what can we do at Handle with Care Florida to help you? So we're going to give this a few more minutes. We've got a couple of questions sitting in the Q&A, so we are welcoming as many questions as you want to type in while we're waiting for the poll so that we can make sure we answer all your questions. All right, so we've got close to 80% here. I think we're all, the majority of people, let's see, let's go ahead. Scott, let's go ahead and close that out so we can be efficient with our time. All right, let's share the results of that so that everybody can kind of have an idea of what we're seeing here. So majority of us do believe that children in our community are vulnerable to trauma. And, some people, I think, very much do understand their system between law enforcement, schools, and mental health and so forth. And some people, I think those that are answering probably could improve, are probably just not really in tune with how that communication works. And I just want to say, as a mental health provider and someone who's worked with a lot of systems, that it's not that the systems don't want to work together. That's never really the case. It really is just about everyone has such an important part of the piece to fill, and that communication piece is something that sometimes gets dropped just because we all have our own responsibilities and just haven't really figured out how we can all work together. So that's where things like coalitions and teams like this one really come into play. So I'm going to, we're going to slip right in here. And again, I'm going to get through this as efficiently as I can, because again, I want to make sure we leave plenty of time for discussion. And I will ask my panelists join in as I'm talking if you have something you want to add to what we're going to talk about. So I'm looking at Handle with Care and how that model might work in your community. I'm sure there are lots of different questions. So the first step in getting any of this going is to open up those conversations between the key stakeholders. Much as Connie was talking about, it's about having those initial conversations between the four real critical stakeholders, which are law enforcement, schools, child welfare, and mental health. Those are critical pieces to putting the Handle with Care model together. But that's not the end of the story. There are stakeholders within your community that only you know about. But I look at it this way, and I don't know if anybody on the panel would disagree, but I don't think you can spread the net too wide. I mean, really, stakeholders are people who care about their communities and care about the health of their children and the future of their community. But you do need those first four to be sitting at the table. All right. Then what you need to focus in on after you identify your stakeholders is making sure that you have a training plan in place, because that's critical that every person understands their role in the system of Handle with Care, and that they have the resources and the training to do that to the best of their ability. So we do advise that law enforcement, teachers, staff, mental health partners, all of the key stakeholders jointly attend a presentation of talking about the impact of trauma, as Connie alluded to, the ACEs and other elements around trauma in children, the impact of trauma on learning, the key elements of Handle with Care and how they work together, and then the strategies for implementation, particularly within your community. So Handle with Care Florida will mentor you through that whole process and make sure that the trainings you need are in place and available to you. The school and child care agencies should have their own strategic planning sessions to talk about how this is going to work within their systems. So making sure that, you know, there's a person like Susie in place, because without Susie, this would not come together the way it comes together. You have to have a gatekeeper, clearinghouse, all of that in place. It doesn't have to be a Susie. Sorry, Susie, I'm kind of putting you out there as an objectified person, but it doesn't have to be a Susie. But that's for your team to decide who is going to be the collector of the Handle with Care information, and how are they going to guarantee that the information goes to where it needs to go. And we'll talk a little bit more about data that needs to be collected. So the schools and the child care agencies need to kind of work and say, how are we going to make this happen internally as well? Law enforcement supervisors are then responsible to train their patrol officers and their staff on how this reporting and how these encounters work, much like what our captains were talking about. Officers have to be familiar with the on-scene response, which Captain Romano said everyone is trained in, and I'm sure most law enforcement, if not all law enforcement, are. But, you know, just to really help those who may not be as sure about, as we said, do I reach out to this child, and how to get more comfortable with saying, you know, I'm going to look around, and if there's a child, I know what I'm supposed to do. The mental health providers also should be trained and certified if possible in trauma-focused interventions, which I believe most of them are, from my experience. The next piece of the puzzle is forms. As Kat Romano says, none of us is really crazy about the whole concept of new forms or new paperwork, but streamlining is something that we've learned to do as well. But documentation is important, specifically for us to understand what's really going on in our community and how we can respond. So your key stakeholders need to develop protocols that they all agree to, memorandums of understanding that they all sign off on, basically because, as anybody knows, if a system's going to run smoothly, everybody has to know very specifically what their role is, what they're responsible for, and how to troubleshoot when they need to. So we'll provide you, Handle with Care Florida, will provide you examples of agreements and protocols, and we have the expertise of Handle with Care West Virginia as our mentors as well, to tailor your agreements to your area, county, jurisdiction. Also, the schools and the child care agencies need to work on having a form system or standardized dissemination of information system, such as what is the Handle with Care forms going to look like. Susie, you have a protocol you use that I think is really interesting, where there's the Handle with Care notice, but you also send out something else with it too. What is that?
Right. So with every notice, we send the guide, which outlines our process and what to do in handling a student that is experiencing trauma. You know, sometimes there's staff changes, and maybe this teacher hasn't ever dealt with Handle with Care and doesn't know what to do. So I'm there for them to email me back and ask questions or have concerns about their students. So I'm able to get everybody together as a collaborative and say, what can we do to help this student succeed? So it really takes a village. So we're all on board here, and we love the model and what it does for our schools.
Absolutely. And so also along with that, I was just made me think about how we also need to inform communities. And that's another thing that, particularly if a community can get the support of a coalition or a task force or a committee to help work with, you know, really transforming a community into being like a Handle with Care community, right? So I know, Susie, that you put notifications up on the school district's website saying, you know, we're a Handle with Care school district, and we have posters that schools can put on their school buildings, daycares can put in their buildings saying we're a Handle with Care school. And I think that, you know, as a parent, I certainly find some sense of pride and I guess a little sense of safety too, knowing that my school is that invested in each student's success. Because even if my student may not be experiencing the trauma, we know that maybe the child sitting next to my student is, or the child that my student's going to interact with. So I think it's super important to have a rollout, if you will, that very much is about educating the community as a whole. Thank you, Susie. Another piece of it is making sure that your counseling services are in place. It really is important for the school to have a strong commitment to, if possible, provide space in the school to do counseling. As Jane was saying, mobile crisis units can also respond. And if you can't provide the space, I think there's a lot of ways that schools have been very creative about making sure that the students get the counseling at the right time. This other piece, the collaboration and data review, I think this is what takes Handle with Care to a whole macro level, if you will, is that you've created this team, and the team you see in front of you, these panelists, represent part of that dedicated team. Not all of it, as Connie said, we're about 20 members, comes and goes, and we add new people, and we're open to anybody who cares. But the team leaders, it's very important that they review the Handle with Care data. And it's the public school that supplies us with the data. It's data that they already collect for the most part, and so there's not necessarily extra data at this point that needs to be collected, but it's bringing that data together, putting it in front of the team, and us talking as different stakeholders, different representation of the community to say, what is this telling us about our children? What is this
Linda,
telling us about their ability to learn? Go ahead, Sandra.
I just wanted to say something here. I think that one of the things that we have seen, which makes this program seem very worthwhile, is that we're picking up children that were not necessarily coming to the attention of authorities in other ways. So as we've looked at who's coming through the Handle with Care program, there is some overlap, but not entirely. So we're seeing children who were not coming to the attention of Child Protective Services. We're seeing children who were not coming to the attention of school officials for disciplinary problems or other kinds of problems. So we're able to touch children at a very early stage, and we hope keep them away from some of those other systems if we can intervene effectively.
Very
And
important.
just to piggyback on that, within 2 weeks of initiating Handle with Care in Manatee County, we had an affluent private school with a Handle with Care. And we had not segued into training or communicating with our private schools. We were just trying to, get a grip on dealing with the public school system. So, so that was kind of interesting, and that goes to what Dr. Stone is talking about, that sometimes the Handle with Care notices, you are surprised at the schools that are involved, or they can be more affluent, and they can be schools that you might not have thought would have been involved, or the children are coming from those schools.
Good point. And I think that this team is a wonderful, then again, community transformative body to say, hey, look what's going on in this zip code. We're getting a lot of Handle with Care in this zip code. So what could be going on in that neighborhood that we need to be aware of? Is there anything that we should be talking about in terms of just overall prevention and intervention? So looking at the data, looking at, like Susie said, looking at longer term outcomes as well. We're also, just now with the addition of our epidemiologist, we're able to start to pinpoint not only outcome indicators for positive outcomes, outcome indicators for negative outcomes, but also let's start to identify some resilience factors as well in these kids, and see how we can promote those resilience factors as prevention specialists and as educators and community supporters. Okay, so real quick, how do we get started? So now I hope we've all got your excitement going, and you can't wait to hang up from this call and start making your stakeholder calls. How do we get started? Well, the first step is to bring together your stakeholders. Handle with Care Florida can assist you by helping you put together your stakeholder list, brainstorming with you, providing you samples of letter invitations, providing you platforms with which to disseminate information. And we also have some financial resources, again, thanks to our SAMHSA grant, to bring your team together. So as you look at bringing your schools into play, here's just some examples. I'm not going to go through all of them. I think you can see them, of who you want to talk to at your schools. You do have to get administrative support. It can't really work as well if you go principal to principal, although those visits to principals can really make a difference in terms of excitement. But this really, West Virginia found this out, Michigan found this out, Maryland found this out, that getting the school board and the superintendent on board from the very start can really enhance how the program is able to start functioning. And there are some resources that need to come from the school. So I'll just interject this, because this is often a very common question. What does Handle with Care cost? Well, Handle with Care as a model doesn't have fees associated with it. There's no cost from Handle with Care Florida either. So there's no real particular cost for adopting the program. There's just the understanding you would adopt it with fidelity as we've described it, and you can see it if you go to our website. But there is cost in that there are human beings and systems that need to be leveraged in order for the data to be provided, in order for the calls to be disseminated appropriately. And so there have to be discussions about how those resources are going to be allocated. Now, Susie, you were able to come on as a Handle with Care coordinator. How was that set up in terms of your time and how your time's allocated?
Well, I am here to ensure that these notices go out prior to the school day. So there's dedication sometimes on the weekends, but early mornings to make sure that the school is notified and can act appropriately. So it doesn't take too much time and effort to do the forms and the emails, but when it comes to collaborating and getting together about the student, it takes more meeting time and making sure that we're putting the proper interventions in place for the student after the notice.
So Susie, was your position in place before Handle with Care?
No, it was created.
It was created, okay. So some school districts may need to allocate some sort of support in terms of bringing on someone to fill your role. Some others may have people already within their structure, right? That could carve out that little bit of that time that it takes, that have the knowledge and training and credentials to be able to do that. It's just gonna depend district to district, I think, at that point. Okay, law enforcement, when you're inviting law enforcement, again, here's just a short list of who you might include in that discussion. Everything from the state police down to your school resource officers, if they are your law enforcement and not part of the school. Probation, prosecuting attorneys, all of the law enforcement entities in your county or your jurisdictions. You need your mental health and child protective services representatives on board. Your child care services, if you plan on starting with using early childhood or daycare as well. As you heard from our panel, we didn't do that from the start, but it became something that we saw as very important. So we have added it into our Handle with Care as time has gone by. And then others you could include. Again, I'm saying the net can go as wide as you want it to go, because I even added parents in here, which wasn't on the original list, because I really think consumers are a big part of what advises us in making our communities better. So whoever you want to invite, I wouldn't say hold back, just invite them. They're either interested or they're not. And I think peer pressure is really important when you're trying to transform communities and getting people interested in what you're going to do. All right. So real quickly, what can Handle with Care Florida do for you? And then we're going to jump into some questions and answers. We can assist you with identifying your stakeholders and helping you with the planning of that first committee formation. We can help with your committee meetings. We can provide you forms, templates, documents, webinars, anything you want. We can also cover some financial assistance with some of your initial costs. We can set up consultation meetings with our team and yours, or some specialized meetings. Say you want our law enforcement people to talk to your law enforcement people, or you want our school partners, our Susie, to go to your Susie, however that might work. So we can set up those consultations as well. We can provide trainings on trauma responsive care at any level. We can advocate with you and for you throughout the whole process. We have our knowledge, we have the knowledge of our partnership with all the other Handle with Care programs across the country. And we can help you with your data collection protocols, how to identify which data to collect, how to collect it, the easiest way to collect it, and so forth. When you agree to become a Handle with Care Florida team, we will give you access to our Handle with Care Florida website so that you can promote your work, talk about the good things you're doing, that sort of thing. Your monthly data will be able to be added to our dashboard on the website so that everyone can see your numbers and how great it's going for you. Our epidemiologists will help analyze your data, and report out the findings in comparison with the other Florida and national data to see how you're doing in terms of numbers as it compares to perhaps like urban areas, rural areas, that sort of thing, to see how you're doing. You'll have access to everything that we have in terms of our PSAs. We're just now finishing up a 6-minute Handle with Care video that is just for Florida. It should be out in the next month. You'll have access to that to promote the program as well. Videos, trainings, brochures, flyers. And you also have regular support meetings with all the other Handle with Care Florida teams, as well as the national team, which gets together on a regular basis as well. Last thing, if you launch your Handle with Care program between 2020 and 2025, we will pay the registration fee for a representative from your team to attend the National Handle with Care Conference in West Virginia. They put together an amazing conference. We're doing it virtually right now, but I think anybody on the team who's attended can tell you it's a quality product. And then we'll work with you on your team to mentor other teams so that your neighboring communities will also benefit from this relationship. Because we just found out recently, didn't we, team, that when something crosses county lines or jurisdictions, we thought to ourselves, gee, I wish they'd been a Handle with Care community, because then the communication would have been connected. So I think that's really important in bigger areas. So these are just some examples of some of the flyers, products, branding kinds of things we have available to you to share. And I'm going to stop talking at this point. Here's our contact information. You can also, again, everything is accessible through handlewithcareflorida.org. And again, we are here to make sure that everybody's project gets started in a great way. So I'm going to stop sharing here. We're open for questions and answers, and any other information that our panel would like to share that they thought about while I was talking. So let's see what kind of questions we have.
Linda, I have one thing. In terms of stakeholders and people to include in the community, I think one segment that was not listed there is the faith community. And I think we have found them to be very supportive, and particularly a lot of churches have childcare programs, and they do a lot of youth programs. So they can also be a very important partner.
Oh, very, very important omission. Thank you, Sandra, for mentioning that. Absolutely.
Linda, just two quick things. As we're talking for stakeholders and throwing the net wide, our local community-based care organization, who is responsible for foster care in our circuit, they do their own Handle with Care notices to the school district for things such as Baker Acts, Marchman Acts, arrests, sibling separations, those kind of things. So that's something to consider. And also, when Linda had mentioned parents, I can't think of a better partner to have, especially for things such as deaths in the family, losses of a pet, those kind of things. A parent should be able to do a Handle with Care notice for sure for those kind of things, and many others. So I just wanted to throw those two things out there.
Great, thank you very much. Okay, let's see what kind of questions we've had posted. And again, anybody who's out there, if you've had a question, just go ahead and put it in the Q&A, and we will answer them. Okay, so we've got a question here. Has this primarily been more effective with elementary age youth or all age ranges? Good question. Anybody have thoughts on that?
Yeah, I'm going to jump in on that one, and I'm sure other people will add to it. I think that the younger the child is, the less, the more impacted they are, because they lack the appropriate communication skills to express the trauma and to deal with the trauma. So the younger the child, the more impact, the negative impact it can have. But that's not to say that older kids are not affected by it. So Nathan, I know you've muted yourself, but I'd love for you to unmute and talk about that child that was, I think, in middle school, and how the teacher reacted when she saw the Handle with Care notice and he was supposed to give a book report.
You just reminded me of that, and I'll preface that story real quick, the anecdote, with that the majority of our Handle with Care, the data shows that it's middle school students and early high school students mixed in with those elementary school students for the amount of Handle with Care notices coming in. But briefly, and this story came from one of the school nurses to us, that a teacher received a Handle with Care notice for a middle school student. Middle school starts, let's say 7:30, 8 o'clock in the morning, and the time stamp on that was around 3 o'clock in the morning, so just a few hours prior. And this particular student was required to do an oral presentation that morning. And the teacher just went up to the student and said, "Hey, Johnny, can you postpone your presentation until tomorrow? And Susie needs to go today." Didn't mention Handle with Care, didn't mention anything else. And she said, this teacher, the wash of relief on this child was, just something visibly noticeable. And so that's how Handle with Care works. That child had no idea that a Handle with Care notice existed on him, but the teacher took it upon herself to just postpone that book report. And that was the only response that was needed.
And when we talk about it, again, it's the learning switch is generally off, because the more traumatic the event to the child, they're just replaying this thing over and over again, and they're not really able to learn. So you just have to really I think that was a very important, impactful information that I got when we started this training, was that the learning switch is off. And so until you can get that child to feel safe and to feel comfortable and get them back into a mode of learning, they're not going to be learning. They can be disruptive to the rest of the classroom. I want to just stress that when we were doing the law enforcement training piece on this, either myself or Nathan and I together would go, but we went to every squad meeting. Very, very difficult to do, because we have a number of law enforcement agencies in our community, and we had to go to all of the squad meetings. And so sometimes that would take weeks to do, but it was important for them to hear directly from us, because we're passionate about it and we have an understanding of the importance of it. And we could talk about these slight nuances, the anecdotal information. And we even met with our narcotics officers, because these narcotics officers are going out, and sometimes there are drug search warrants where children are present. Sometimes these parents hold these kids home while they're shaking and baking in the kitchen with whatever drugs they're making, and these kids are impacted on these drug search warrants. So it really became important for us to give that message and have them be able to ask us questions. So I will encourage law enforcement, when you're getting ready to do this and you go through the training, meet with the squads, talk to these officers, and answer the questions that they have or may have about it. And then maybe go back again, or let them have an opportunity to bounce things off of you. But one narcotics officer whose wife, he works in Manatee, but his wife is a school teacher in Hillsborough. He took this information home and he was sharing it with her. And she said, "We want this in Hillsborough County. This would be so helpful to have." So we learned recently, we had a case where Hillsborough, a child was abducted, raped in Hillsborough County when she was visiting with her father. Came back to Manatee County, went to school, talked to a teacher about this traumatic event, and they thought, "Oh my gosh, what happened? It fell through the cracks." When we did the research on it, it was an agency outside of Manatee County that was aware and didn't have Handle with Care. And so I would just like to share, when we get a Handle with Care, and let's say we're doing it here and it's a Sarasota child or a Hillsborough child, we're going to be calling that school. Susie, is that not correct? You would reach out to a school in another jurisdiction?
Right, absolutely. I do everything I can to research every notice that comes to me. I report to charters, other counties, daycares, so I want to make sure that those notices get out, absolutely.
And so sometimes she's communicating with schools that are not part of Handle with Care, but they're excited when they go, "Oh my gosh, somebody, what is this thing?" And so thank you so much for telling us so that we can address this behavior appropriately. So it's helpful if we can get everyone in the state. Just imagine how impactful this would be.
Thank you, everybody. So here's a question, and I think we might have hit on this, but do private schools participate in Handle with Care? And if a Handle with Care notice is received for a student at a private school, how do we handle that?
So as I just stated, when I get that notification and I research that student, I call that school. What I've found is they do not participate in some of our charters. They don't have Handle with Care either. So I send them out as I get them and, you know, give it to the counselor as well.
Okay. Excellent, thank you. So a couple of questions that have to do with people's concern, I guess, about confidentiality. So one is about, does law enforcement need to get parental consent to share basic information with school staff? And then the other point, the other question that somebody raised is, isn't sharing a child's name a violation of Marcy's law? Those are good questions. So response from that?
Okay, so Nathan, you might help jump into this as well. I do not, to my knowledge, it is not a violation. We are the school has adopted Handle with Care, and law enforcement is public records wise, we can share that information. We are not sharing any details. In other words, we're not saying what has occurred to this child. We're not giving any details. We're just saying, this child may, the notice pretty much says this child may have been exposed to a traumatic event. Please handle this child with care. So it gives no details. And so it's not a violation because we're not giving out any details on this child whatsoever. And it's about the ability for the school to address the behavior. They're not going to the child and asking the child questions or talking to the child. All they are doing is monitoring the behavior so they can address the behavior appropriately. So it's really not about go single that kid out and start talking to that kid and start providing that kid counseling. Remember, only about 10% will even need anything more in depth than to be handled with care. And I think we gave a really good example of a child that had a traumatic event at 3 o'clock in the morning. They were up and all the teacher did was say, hey, I'm gonna have Johnny do his book report today, and would you do yours tomorrow? That's what we want. We want that child to understand why the homework wasn't done, understand why the child is staring off into space and is not focusing, and not punishing that child. So it's really about addressing behaviors.
And I would just add that it took us, and I'm sure most of them on this webinar can believe, to get our one-page form vetted through multiple different agencies and their legal staff about a year to do that for a one-page form. And so we have assurances from legal folks that this does not violate HIPAA, this does not violate FERPA. In fact, we went as far as to add a statement on the form, should this form be requested via public records request, that any identifying information of that child be redacted. So therefore, it basically would be a blank form that just said handle with care at the top with a bunch of black marks through identifying information. So I would assure those that this doesn't violate any privacy. And like Connie said, it doesn't include details. And should a person from the school reach out to Captain Romano or Captain Knight and say, hey, we want details, they're not going to provide them with the details. It's just a notice that something may have happened, and you keep an eye out like that teacher did and then react appropriately. And perhaps with those 10%, you refer those folks to Jane's folks out in the community. And that's really it. And I actually think that further to add to that, with the Marjorie Stoneman Douglas Act, I think that it would support Handle with Care here in Florida. I'm not sure on that, but I would be willing to put that out there.
Excellent, great. So here's an interesting question. I kind of put two questions together because they kind of, to me, have some similarities. First question is, how do we handle with care when school's not in session? And we've done that recently. And then in addition to that recently, and the question asked is too, how do you handle with care during a pandemic? So what are some of the things we did? Because I know we did some great things. I'll start with what we did, and then I'll listen to the stakeholders. Handle with Care Florida or Drug Free Manatee, one of the things that we did to help once we saw that children were not being seen by adults on a daily basis like they would have had they been in school or daycare, we became very concerned about the lack of mandated reporter eyes on them, if you will, and the isolation of being with parents who may not, the school may have been the only safe place that these children had to go. And so we became very concerned. We came together with several meetings to talk about how do we take Handle with Care and really help children who are already vulnerable, but even more vulnerable now. So one of the things we did, and the team did other things as well, was we created a flyer on how to teach everyone in our community to be a mandated reporter, and distributed that flyer in all of the food distribution bags that were going out from the food pantries. And also my team, we went out and we went to Publix and Wawa and 7-Eleven and all the places that we knew might still be seeing children, because the children will come in with the parents, and saying, hey, hang this up in your employee break room. Talk to your employees about what to look for, how to interact with children to just kind of make sure they're okay. Give them a sense that there are people out there that are looking out for them, even if you don't make a Handle with Care call. It really is about keeping communities aware of our vulnerable children. Let's talk about how we did Handle with Care calls over the summer and with COVID.
I just want to jump in on that. We learned early on that you cannot take any time off. So if the kids are off, when we first started this in 2017, you cannot take the summer off. You cannot take spring break off. So do not let your officers take any time off from doing Handle with Care notices, because once they take any time off, then it's sort of out of sight, out of mind. They forget about it. So we thank all of our law enforcement agencies for getting the word back out there. Hey, don't take the summer off. Don't take any time off. Please keep the Handle with Care notices coming. It helps Susie to see them. And when they come back, that way we can, if it's within a certain time frame, we can be watching for behaviors when these kiddos are back in school. So Susie, I don't know if you want to speak to any of that, or if anyone else wants to jump in on that, but it was problematic for us because the numbers fell way off. When they took summer off, we were getting hardly any Handle with Care notices coming in.
Right. So what's important to think about is during summer, we still do have summer school. So when it's important to send those notices, so I can still send them out to teachers. And in regards to e-learning, it's very important those notices come in because they have online teachers, and those teachers need to be observing the background and the environment and how the students dress, how they look. Our social workers are still doing home visits. They're out there, if that's necessary, if we think something's going on, we're going to go out and check on them. So it's very important not to have any break of data, because we still need to know what's going on in our community during that time as well.
It kind of reminds me of how we had a meeting, remember, and we go over the data on where the calls are coming from. Like this call is coming from Bradenton, this call is coming from Sheriff's Department, this call is coming from CPS. And when we start noticing the data that maybe a certain police department isn't reporting in anymore, I mean, the minute we saw that last month, Susie and I said, hey, we're going to go pay a visit because we think maybe something may have shifted within this police department. Maybe new leadership, maybe new something else. We need to remind them. And Susie was great at saying, let's bring them food. Let's do whatever we can do to remind them that we're all in this together, and it's very important. And we know that things happen. So reviewing of that data is critical too, to find out not only when it's dropping off, but where it might be dropping off in little pockets, and how we can as a team go and beef that up.
And one thing for the school administrative people that are on and watching this, just imagine in a pandemic, you get a Handle with Care notice, you notify the teacher, and the teacher doesn't see this kid. Day one, day two, you start to worry, okay, we got a Handle with Care notice, now we're not seeing Johnny at all. So I think it can elevate that to something that might need more attention. And there are many cases that law enforcement goes out on where it's not a child protection, necessarily a child protection call. So at least somebody else is looking to see how is this kid doing, and so forth. So I think it's critical, even more so when we're in a pandemic, when there are fewer eyes on these kids than we normally have.
And on our end, once the referral's completed, my school-based therapists are able to do telehealth, whether it's through a video or through the phone. They are also trained to kind of observe and to listen to any voice tone changes or people in the background, that kind of stuff. It's really sad to say that there's a good part about COVID with everything that's happened, but the really great thing about it is we have had a huge increase with parental contact. Our first year that we were in the schools, we didn't have a lot. These last 2 years since March and this year, the amount of contact that we now have with our parents has significantly increased. And so we're now bridging that liaison, and they're part of that support system for that kid. So it's really a great opportunity.
Good point. I have, I think, one other question that doesn't relate to starting Handle with Care, because I'll try to answer those as we wrap up. Someone brought a very interesting question about, as we follow these young people, Susie, we look at them in 30 days and see where that and so forth. And someone was asking a question about more looking maybe at the big picture and saying, do we maybe make a note of when this traumatic event happened and maybe check in with that kid at an anniversary time? And I think that is an amazing observation, because, and I'm making note of that, and I know who sent it, so thank you for that. But making a note of that, that's something to consider. If it's a very traumatic event in a person's life, we in mental health, right, and we certainly know that anniversaries can be interesting. Or if we know that someone's parent got incarcerated, and then we hear that, this is the time when they're coming back home as a family therapist, I know that's a huge, huge reorganization for that family. So interesting point, and I like the idea of looking at anniversaries and things like that. So we will take that on back to the team. Thank you. Anything anybody else wants to add? Somebody asked about starting Handle with Care during COVID, and I certainly can have some conversations with some individuals about doing that. But any other advice from the panelists, like obstacles and how you overcame them, or what did we learn through this process, and what advice you would give to a grassroots group like we were to get this thing started? Anything?
I'm going to jump in there with a couple of things I've got written down here. First of all, mainly for law enforcement, it doesn't take the place of a child abuse neglect hotline notification. That's number one. So when we do the training to the squads, we make sure that we tell them that. Handle with Care is not the same circumstance as getting your notifications to the hotline per statutory requirement. Also, having a written policy that ensures a consistent application of Handle with Care to all children, regardless of race or ethnicity, is so very critical. So, we're not, giving these kids an advantage that we're not giving other kids. Make sure that the policy includes a way to notify supervisors for law enforcement, so that those supervisors of that officer know that a Handle with Care was completed. Maybe it'd be a checkbox. Because it's just, if you've got a policy, it needs to include a way of knowing how your officers are doing this. Providing that training to school teachers, school nurses, principals, and assistant principals, all of those folks, so that they know how to respond and to what behaviors we should be looking for that would indicate a child is in need of more in-depth mental health counseling. And the data fields, make sure that there is an agreed upon data fields that you want to collect, and that you discuss those data fields at those monthly meetings. So those were some of the ones that I thought was most important.
Excellent, thank you. Anybody else?
I was just going to say, be patient with the process and rely on your resources.
Yeah, good point, good point. This is definitely, I mean, Susie said it takes a village. this is part of our village, and our village was really hurting when this all started out, and we recognized that there were those that were suffering silently and hidden and really needed to be recognized and supported, because building their resilience factors, as we know, can prevent repetitive cycles of behavior and prevent other long-term outcomes. So I have a lot of people who have asked again about how to get in touch with us. So I'm going to do a quick flick of that information one more time. And then while that's up there, Scott, if you could put the exit poll up there for me, please, so we can collect some information on where everybody is and what they got out of this, that would be great. So again, on your screen, you should see the exit poll, and hopefully you can see our contact information. So those of you who are interested in entering into a conversation about getting started, feel free to call or send a message through our contacts through Handle with Care Florida, and we will get back to you immediately. We want to see this just grow, and our goal is to have all of Florida Handle with Care state at some point. So thanks to the support of SAMHSA and to our local support, we're able to provide all of this mentoring for you. So, all right, so we're getting our information about what everybody thinks. If you go to our webpage has a lot of information. So Handle with Care florida.org. You will see more information about the model. There's some videos, there's samples of forms, all of the things we talked about here, and then some other additional resources. You can also go to the contact map, where you'll see that there are currently now in Florida 2 counties who are Handle with Care models with the fidelity, and that is Manatee and Hernando, and we're excited to have Fernando join us over the past couple of weeks, and we're looking forward to other counties coming in as well. One of the things I wanted to mention too, if you're in an area and you're saying, well, I live in this particular town, and I want to get this started, I can tell you what we have learned from other grassroots organizations across other states who started much as Drug Free Manatee and this group started, that countywide is really the most effective way to start. And Maryland found that, and Michigan found that, Ohio is finding that. And so that's one thing to look at if you want to go countywide. Other than that, if you're a larger area, like I know we have some people on this call that are Miami-Dade, Miami, and North Miami, bringing all of those people together at some point would probably be the best bang for the buck and get everybody involved. Okay, we'll close the poll then, Scott. Okay, and stop the share. And let's see, I think we have maybe a couple of last questions that came in. Let's see. Oh, pretty much everybody just wants to get going, wants to find out how to do this, and I hopefully, with all the support of this great group here, hopefully we've ignited some really good passions, and we can all be accessible to you to help you move forward. So any final words, anybody? All right, I want to thank everybody. We were able to do this in great time, and I know there's more things people want to know, so please reach out to us. We are here to support you, and we wish everybody a safe and prosperous day.